Hello, my name is Chad Johnson, and welcome to our special project around mental health care for school students. Today, I want to address a topic that affects millions of people worldwide: anxiety. Anxiety isn't just a temporary feeling of stress or nervousness, but a complex and overwhelming mental health condition that can significantly affect one's daily life. It's crucial that we understand what anxiety is, what causes it, how it can be treated, and what can we do to support those who suffer from it. First, let me explain that fear and anxiety are not the same thing. Fear is a normal thing for all humans, as it is a response to stress, a mechanism that alerts us to potential threats and prepares us to face challenges. In other words, a fight or flight reaction. However, anxiety is a fear of a threat that has not or may not happen. And examples would be public speaking, trying to talk to other people, or even physical or mental abuse. Extreme anxiety on most, if not all, encounters can develop into an anxiety disorder. There are various anxiety disorders, including generalized anxiety disorder, social anxiety disorder, panic disorder, separation anxiety, and numerous specific phobias. Several factors contribute to the development of anxiety disorders. Genetics can play a role, as individuals with a family history of anxiety may be more susceptible to it. Environmental factors, such as traumatic experiences or chronic stress, can also contribute. Additionally, imbalances in brain chemistry and neurotransmitters can be a significant factor in the onset of anxiety. Understanding the causes of anxiety is crucial, but equally important is in recognizing the signs and symptoms. Anxiety can manifest physically, emotionally, and behaviorally. Physical symptoms may include rapid heartbeat, shortness of breath, muscle tension, and sleep. Emotionally, individuals with anxiety may experience excessive worry, fear, irritability, and difficulty concentrating. Behavioral signs can include avoidance of certain situations, seeking reassurance, and changes in routine. Now here's a young lady who has experienced some sort of anxiety in her life. Take it away.
Hi, my name is Marie, and I'll be talking about my anxiety. Honestly, I've been struggling with it for a very, very long time, and it's not as bad as it was. It used to be much worse, and honestly, sometimes it just takes time to overcome it, but it's how you it's how you deal with it, and it's how you think about your anxiety, and it's whether if you think that you're stronger than it or not, because it plays a huge part when it comes to coping mechanisms and all that. Anxiety is it's a really tough thing to deal with, and for the people that have severe anxiety or depression or anything that makes them feel like they don't have that worth, it's really difficult. And my journey isn't over. I actually still go through a lot of rough patches, a lot, and it's really hard because sometimes I feel like I am not worth it, and sometimes I just have to think and be left with my thoughts or find something to help me get away from that bad mindset. Anxiety altogether, though, it's a journey to overcome it, and it takes a lot of time to honestly, I still have a long way to go, but I'm trying my best, and that's honestly all you can do. So, thank you for listening.
The good news is that anxiety is a treatable condition. Some medication can be effective in managing anxiety. Cognitive behavioral therapy and serotonin reuptake inhibitors are widely used types of solutions that can help individuals find and change negative thought patterns and behaviors associated with anxiety. If these solutions don't work, there are many different types of therapies that can also help with who work with multiple methods of treating anxiety. A popular technique to quell anxiety is called the 3-3-3 method. It starts by naming 3 objects around you, finding 3 different sounds that you hear, and then touching 3 different things, such as a limb or an item around you. It may sound ridiculous, but this is shown to temporarily help manage anxiety in the moment by grounding yourself in overwhelming situations. The journey to recovery is not solely the responsibility of the individual facing anxiety. It is a collective effort requiring understanding, empathy, and support from friends, family, and society. If you know someone who is struggling with anxiety, the most important thing you can do is to just listen to them about their struggles. Showing empathy while listening to someone is the best way to help someone at any mental health illness. Most often, people just need someone to lend an ear who can confirm their feelings without judgment. It is also helpful that they suggest to see a therapist who specializes in anxiety. Counseling and therapy can offer helpful coping strategies to handle anxiety. Anxiety is a complex and challenging condition. With understanding, support, and proper treatments, mental victims can lead fulfilling lives. Remember, it's okay to be scared, but there's always going to be someone who can stand by your side. Sometimes, life isn't so bad as it seems. Taking opportunities may lead to something or someone life-changing, and we must try to keep on creating and pursuing these opportunities. I hope everyone watching will help me spread the awareness for anxiety and how it can be cured. Thank you.